Let's bring in Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with us this morning. Good morning, Dr. Joe.
Hey, Ray. How you doing today?
I'm doing extremely well, my friend.
Great.
Where do you want to start today?
You know, we haven't gone down the road in a while of early sports specialization, certainly since before the pandemic. There's a conference coming up at Boston Children's, one of my mentors, on what effect has the pandemic had on. We call this issue or problem in sports medicine early sports specialization. The reason for that, Ray, is we're talking about kids who specialize in one sport in grade school or definitely pre-high school. By the time kids get to high school, playing one sport is really pretty almost standard these days because there's so much competition for sports, and a lot of kids only play one sport by high school. But early sports specialization, when these kids are in grade school and younger than high school, and there are issues related to that, and we know that. The thought process is if kids play one sport and they really focus on it, they can get much better. But a lot of times the talent, as they get into their bodies mature and everything, takes over. And that less than 10% that get a scholarship or less than 1% that ever play professionally, most of the time, if you go back and ask those people, they played multiple sports. They played a variety of sports, and they didn't specialize. So it doesn't really bear out in the long run that it makes people better athletes who get scholarships. There's certain sports that are really, this is seen really frequently, gymnastics, figure skating, dance. Those are the individualized sports. Soccer, baseball. At an early age, kids specialize in some of the problems. Number one, we talk a lot about the recurrent overuse injuries. We see a lot of stress fractures in these 9, 10, 12-year-old kids coming in our office. And that's a sign that they're overdoing it. They'll have these stress fractures or growth plate injuries. We talk about here Osgood-Schlatter's or Seavers. These are growth plate. The growth plate isn't as strong as the bone. And when there's increased load of doing the same mechanical activity over and over and over again, they lead to injuries. Whereas if you change sports with the sports seasons, you put a different load on the body, and there's a lot less of these overuse and overload injuries. So that's number one. Number two is a little trickier to diagnose, and in a career of being in pediatrics sports medicine is finding out kids who have burnout. When there's a lot of kids with anxiety, they don't come in and say, hey, I'm anxious. They have a loss of enthusiasm for their sport. They don't have as much fun or bonding with their teammates as much. One of the real tricky ones is they'll have recurrent injuries, and what should be getting them better, they're not getting better. And the trainers and therapists come up to me and say, hey, I don't know why this kid isn't getting better, but it's a pattern that I've recognized through the years. They don't really want to get better. They don't want to get back with their team. It's a sign. And we've been doing an anxiety survey for the last 2 years, and it's really an eye-opener to me, Ray, of how many of these kids have anxieties from other things in life, too. And I think since the pandemic, this burnout in sports and anxiety has actually gotten worse. And the third point I want to make, though, is be careful not to classify or label it as always being an issue of pushy parents. Many times it's the young athletes themselves that just really want and love one sport, and they want to play it all the time. Almost kind of like an exercise addiction that we see in adults who just can't break away from setting up their whole day around their exercise program. And so exercise addiction is something that we see to some extent. Don't always label this pushy. So a couple things. This is a golden period for kids. So my recommendation is to expose your kids to new activities in sports. Say, for instance, oh, my gosh, this week in Akron, the Soapbox Derby. What a great opportunity that is, for kids to do different things. We don't want parents to just add this to the activities kids are doing. So if they're playing year-round on a team and then adding new and more activities, we're going to get into the overuse areas. So it's really a good idea to try new sports. If you're in a team sport, try an individual sport. Learn tennis, golf. It's a great time in their life for kids to learn sports. They learn these things very quickly at this age. And so my strong recommendation is try to diversify when these kids are young. Get them playing a variety of different sports. Look out for burnout in your kids. Look out for overuse injuries in your kids. and let's have our kids back to having a lot of fun again. And as they mature, we'll see the ones that really turn out to be the greatest athletes when they get up into high school and beyond. But really, I think in the pre-high school years, it's a time for having a lot of fun. So make sure that you allow your kids to have a lot of fun, especially when we talk about beautiful times like summer like we have right now, Ray.
All right. Great story, Joe. Good having you back, my friend. We'll reconnect with you again next Wednesday morning. Thank you for the education again, Joe. It's always appreciated.
All right. Have a great week, Ray. Thanks.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He joins us Wednesdays here on WAKR.